All right, let's get started back. Um, we're going to start talking about cognitive therapy now. And as you can see on this chart, cognitive therapy is one of the most widely used types of therapy nowadays. Um, it's often used in conjunction with behavioral therapy. When you put them together, it's called cognitive behavioral therapy. It's a big shocker there. Um, but cognitive therapy is used a great deal in today's American society. So, cognitive therapy teaches people new ways of thinking. People tend to have certain assumptions in their lives, certain maybe maladaptive ways of thinking, and a cognitive therapist will challenge those ways of thinking. If a person maybe makes a big deal out of everything, like the world's coming to an end, they might say that they're making a catastrophe of everything, and they'll use a term like catastrophizing. You're catastrophizing everything if you just think everything is the end of the world, and they will constantly challenge a person's way of thinking, trying to get them to look at different ways that they could think about any given situation, which might help them feel better. So an example here's a baseball player. A baseball player may fail 70% of the time, but you can look at a 300 batting average, succeeding 30% of the time. Is that good or bad? Someone might say, well, I'm failing 70% of the time, so that's bad. When in reality, if you know anything about baseball, if you succeed in getting a hit 30% of the time in Major League Baseball, that makes you really good. So a cognitive therapist will try to have a person look at situations differently if they're looking at things too negatively. That's their job. Is they work on the way people think. This is just again showing how people think. Here's just one example. Someone loses their job. They could have an internal belief of I'm worthless, it's hopeless, I'm a terrible person, and that leads to depression. A cognitive therapist would try to get them to change that belief and to where, okay, maybe I'm not worthless, maybe my boss is a jerk, maybe I deserve something better. That would lead them to probably not feel depressed, but feel some hope. So you can see there where the cognitive therapist gets them to just think about things in a different way, and that will lead to changes in their emotional well-being. A guy named Aaron Beck is one of the leaders in cognitive therapy, along with a man named Albert Ellis, and those guys are really big with cognitive therapy. Now, Aaron Beck noticed that a lot of people that were depressed tended to see the world in the same way. And what he did is he said his job was to get them to take their sunglasses off and view the world in a better way. So again, he used cognitive therapy. Just one of those names that's good to know. Aaron Beck, cognitive therapy. You'll probably see that again. This is just a chart that shows how cognitive therapy tends to work. The red line is patients on a waiting list and did they get better. The blue line is patients who've gone through cognitive therapy. You see they were much less depressed after a period of time on a depression test. So cognitive therapy, it's proven, it works, it's an effective form of therapy. Again, this is cognitive behavioral therapy, which I mentioned a few minutes ago, where you combine behavioral techniques along with cognitive techniques to get cognitive behavioral therapy. This is where you would talk to them in the session, but then have them do homework. This might be good in helping them overcome a fear or um, stand up to a boss or um, have a better way of thinking about themselves. You might just give them some sort of homework to do to help reinforce what you talked about in the therapy session. There's a thing called stress inoculation training. This is just getting a person to basically give themselves positive self-talk in a stressful situation. The example here is, taking an exam. You might, instead of just freaking out and being like, "Oh my God, I'm gonna fail this, and this is terrible, and I suck, and life is gonna end," you might say, "All right, relax. This exam is gonna be hard, but it's gonna be hard for everyone else too. I studied harder than most people, so I don't need a perfect score to get a good grade." So you're just telling yourself positive thoughts to help calm yourself down, and this helps people with their inner self-talk and gets them to feel less stressed. Again, that's called stress inoculation training. A couple of other kind of therapies. Group therapy tends to be a little bit longer. They're 90-minute sessions instead of 45 minutes or an hour, which is what most psychological sessions are. And this is just where people dealing with similar things come together to talk, and they can be support groups, or they can be groups led by a therapist who helps people with whatever problem they're dealing with. When I was in graduate school, I led a group therapy group on anger management, where it had a lot of people in there who had difficulty with anger, and we had a book that we worked through, and people would do homework during the week, and then they'd come back and we'd talk about how they were doing with their anger management. So, and it can be with anything, any kind of issue can typically be worked on in a group session. You'll see a lot of group sessions in mental hospitals as well. Family therapy. This is sometimes called systems therapy, and it looks at the family as a interlocking system. Every family member affects the other, and the therapist basically tries to help them build more positive relationships. But they look at the family as a whole, not just one individual. And any problems that they're having as a family, the family therapist will typically see it as a family problem, not an individual problem. Is psychotherapy effective? It's hard to tell sometimes. But what we would ask is, does the patient sense improvement? Does the therapist feel like the patient has improved? And do friends and family feel that the patients have improved? Most of the time, that answer is yes. Now, is it the actual therapy that has helped them, or just the fact that they were seeking help at all? That can be debated. So the fact remains, though, that most people who enter therapy find some sort of relief for their symptoms, no matter what the specific cause is for that relief. Clients tend to overestimate their effect, how well they did in therapy. Usually because they're in crisis when they enter therapy, so they're entering at a low. And to be honest, some people that enter therapy, just time helps. There's that saying, "Time heals all wounds." Well, that's somewhat true. People enter therapy, they are they're at a real low, so even just through time, they'll come back to a normal level. Also, clients need to believe that their therapy was working, because they don't want to put in that work and not get anything out of it. So clients tend to say, yes, therapy's working. Again, some people are skeptical of if it's the therapy or if it's just time and they would have naturally gotten better. And obviously, clinicians believe that the therapy is working. They um, they tend to believe that that people get better throughout the counseling. They tend to think they're better than other therapists. Um, that failures in therapy tend to come from other therapists. So they're just like anybody else. They want to think more highly of themselves than probably they should. But that's just human nature. So let's move on. How can we objectively measure the effectiveness of psychotherapy? Well, we study a number of studies suggest that thousands of patients benefit more from therapy than those who did not go to therapy. So, bottom line, it tends to help. Let's just keep going. Effectiveness of therapy. As I said earlier, the eclectic model is most widely used in that we choose what would fit. So here's just kind of a chart that shows that for depression, we would use behavioral techniques, cognitive techniques, or a combination of that, anxiety, exposure therapy, cognitive therapy. So you can just see, looking at this, how different therapies would work with different issues. This is just more about evaluating all the different types of therapies. There's kind of a new therapy called eye movement desensitization and reprocessing, or EMDR. This is being worked with post-traumatic stress disorder, and it's an interesting one because it hasn't really held up real well under scientific testing, but people that go through it will swear that they're feeling better, and it's a process where they found some sort of link between the person's eye movement and that helping them deal with the stress of their post-traumatic stress. You're really not going to need to know a lot about EMDR. It's just a new type of therapy. It's an interesting type of therapy. I encourage you to Google it if you want to know more about it, but it's something that's helping people with post-traumatic stress disorder. And again, this isn't something you need to know a whole lot about other than what I've said, that it's a new therapy that works with PTSD. Light exposure therapy is used for seasonal affective disorder. I've talked to you guys about that in class before, where you sit in a box and you get those UV rays help with your mood. This is especially effective in places like Alaska, where it's dark half the time during certain parts of the year. All right, it's important for you to know the difference between a psychologist, a counselor, a psychiatrist, and all those things. So let me go through it. A clinical psychologist, these guys have a PhD most of the time, and they're experts in research and assessment and therapy. A clinical social worker is kind of similar to a psychologist. They tend to have a master's degree in psychology, in social work. Their postgraduate supervision prepares some social workers to offer psychotherapy, and these people tend to deal with everyday personal and family problems. A lot of times you'll find your PhDs, your psychologists, they are ones that will do testing on people. They will also be teachers in colleges a lot of times. Counselors are not psychologists. They tend to have a master's degree. My degree is a master's in counseling, so I'm a licensed professional counselor. So counselors can be pastoral counselors. They can be LPCs like myself, licensed professional counselor, where you have to take a licensure exam through the state and things like that. But main difference between a psychologist and a counselor is a psychologist has a doctorate, a counselor has a master's degree. Then you have a psychiatrist. A psychiatrist has a medical degree. These are the guys that prescribe medicine. And they've been to medical school. They prescribe medicine. They don't do a lot of therapy. They manage medication most of the time. So, once again, master's degree, counselor. PhD, psychologist. Medical degree is a psychiatrist. Difference between a psychologist and a psychiatrist is a psychologist does therapy and testing. A psychiatrist tends to not do as much therapy and prescribes medicine. So hopefully that gives you an idea of the difference between a counselor, a psychologist, and a psychiatrist. All right, on to the biomedical therapies. And we're almost done. These therapies change your body chemistry. A lot of times referred to as psychopharmacology, just the effects of drugs on mind and behavior. These came into effect in the mid-1950s and continue to be perfected to this day. You can see on this chart in the early 1960s, they really got popular. And you can see the massive decline in the mental hospital population. There is no denying that that psychopharmacology has had a tremendous impact on people with mental disorders. It has been incredibly helpful, saved countless lives. So there's definitely a huge place for psychopharmacology in medicine. Plus, drug companies make billions of dollars every year off of it. All right, we have antipsychotic drugs. These are used in kind of your severe psychological disorders where people have psychosis, means they're out of touch with reality. These are used with people with schizophrenia. They're helpful with both positive and negative symptoms. They have a lot of side effects. One of the big drugs for antipsychotics is Thorazine. So antipsychotic drugs helps with people in psychosis that are out of touch with reality. Then you have anti-anxiety drugs like Valium and Xanax, probably some things that you've heard of. They depress the nervous system, widely abused. Some people, do they really solve the problem? They don't get to the underlying problem, but they help people get through the day. So the problem is it is true they are very, very widely abused. Xanax is abused all the time nowadays, and people can get really messed up from it. Antidepressant drugs keeps you out of depression. Most increase the neurotransmitter norepinephrine. There's things like Prozac, Paxil, and Zoloft. There should be a comma right there. They work by blocking serotonin reuptake, which keeps serotonin in the system, which makes you happy, happy, happy. Antidepressants are one of the most widely used psychological drugs. Literally millions of people are on antidepressant medication in the United States alone. Then we get to some of the more invasive treatments. Electroconvulsive therapy. It's a shock treatment. Rarely used, but it is a legitimate form of therapy. This is for people for whom medicine has not worked, and you're literally shocking parts of the brain, sending electrical shock through there. It does help with depression. It It used to be kind of a barbaric thing. It's been perfected now to where, pretty much the side effects are you have a headache. But you go from wanting to kill yourself, like having to be hospitalized constantly because you're wanting to kill yourself all the time, to being able to live a much more normal life. So that you don't really need to know all the ins and outs of why that works, but electroconvulsive therapy is a rare but legitimate form of dealing with depression. And then finally, you have psychosurgery. This is the lobotomy, where they took kind of an ice pick type thing and put it through the eye socket and cut the links between the frontal lobes and the emotional control centers of the brain. This is pretty much not done nowadays. Very much. This was very popular in the 30s and the early to mid 1900s, and people died from it. But it did take people out of that were dealing with psychosis, and would help cure them of that, so to speak. Obviously, very invasive. It's destroying brain tissue and a lot of times creating zombie-like features where the person just doesn't. They're not themselves anymore, but it does keep them from being psychotic. This was probably an unnecessary surgery for a lot of people, but in the mid 1900s, literally thousands of people got lobotomies. So here's a picture of someone getting a lobotomy, and they hit that ice pick through your eye socket and into your brain. Pretty gross, huh? So anyway, those are your psychological therapies. I encourage you to read, and have a good day.